Hi, my name is Lindy Loya. I'm an occupational therapist, certified hand therapist with over 30 years of clinical experience. Today I want to talk to you about splinting after a stroke or a head trauma. When you first have a stroke or a head trauma, the limb is flaccid, it's floppy. And so in the hospital, they'll often give you a wrist cock-up splint. This is the typical wrist cock-up splint. And it's adequate and it's comfortable. But you need to take it off 3 or 4 times a day, sleep with it during nap times and at night. And this is because while your wrist is flaccid, your wrist tends to hang down like this. The tendons in the back stretch out, the tendons in the front shrink, and the joint itself can become solid. If I want to fuse the joint for arthritis, I just immobilize it for 6 weeks. So if you immobilize a hand like this for 6 weeks, it's going to have permanent damage. So the splinting is going to prevent you from having permanent damage. But when you have a stroke, at first, your brain is swollen. As the swelling decreases, motion comes back and muscle tone comes back. Unfortunately, sometimes when the muscle tone comes back, your tone comes back in what we call a flexion synergy pattern. It looks like a chicken wing. Okay, your fingers flex, your wrist flexes, your elbow flexes, and your arm goes back like this. This causes significant deformity, and you can't use that side of the body. The other thing that can happen is an extensor synergy, which is the opposite. The wrist flexes, the elbow stays straight, the shoulder shrugs, and you get a different type of deformity pattern. So you need to match your splinting to the time of your healing. At first, this wrist cock-up splint is excellent, but as time goes on, you're going to want your wrist to go back because the functional hand, like if I'm holding a hammer or a tube, I'm most strong when my wrist goes back and my fingers are flexed. So after a month, you want to make sure the splint allows your wrist to go back. And you do that by simply pressing on the metal inside until your wrist goes back, and you're able to then acquire the functional position of your wrist. That is the position of its best mechanical advantage. Now I want to talk to you about something very important. When you have a stroke or a head trauma, your fingers often go into full flexion for a time, and the skin inside here begins to stink and break down. So this video is going to show you some splinting ideas that will help you to prevent deformity and to avoid the breakdown of your skin. This is simply a kitchen towel. You roll the kitchen towel up, or a washcloth, and you put it underneath the fingers at all times. You shouldn't leave the fingers fully flexed for hours on end. So this is step one in the splinting. It keeps your fingers from going totally down into a fist. As time goes on, you can use bigger towels. The towels have a bigger diameter. And you make sure that that hand is holding onto the diameter of a towel. So the first splint, maybe 2 or 3 weeks. The second, larger towel, 2 or 3 weeks. Then you could spend $300 to $500 on a splint that will bring the fingers up, bring the wrist back. But you can do the same thing with a pool noodle. You take a pool noodle and you cut off a little piece. You take some Velcro that you can buy at any sewing store, such as Joann's. See how it has a hole there? You put the Velcro strap through the hole, and then you take Velcro hook. Now I folded the Velcro hook over on itself, so the hook has hook on both sides. One side of this will stick to the hook, the other side will not. So you want to turn it, put the patient's hand on the pool noodle, stick the Velcro to the hook, and affix it to the back of the patient's hand. So the hook is in there, and you just affix it like this. Pool noodles come in widths as well. I got this one at the 99-cent store, and you can get them in larger diameter as well. I love pool noodle because you can wash it with soap and water. And again, the smell and the skin deterioration is really important to address. Okay, so I hope I gave you some ideas after you've had a stroke or head trauma or other brain injuries. If you have other questions, please contact an occupational therapist, especially a certified hand therapist in your area, and they can give you other ideas. Thank you for letting me work with you today.